Hi friends, I am Dr. Haroon Ashraf, Director Mediguru App Private Limited, and now I want to discuss with you some general issues that may come up in the interview for KPSC examination. Let me clarify this to you that no one can clearly pinpoint what all questions examiner may ask. Examiner can ask anything from anywhere in the world, but there are some criteria based on which we can shortlist some of the issues and we can prepare something about those issues. And every time you have to remember that there is no guarantee that anything from these general issues can be asked, or they may ask something outside these general issues, and however hard you prepare, there will be many general questions which you will not be able to answer. This is the first thing you should be clear about. So, how to deal with those questions which you don't know? You have to just tell the examiner that you don't know about this topic. You be honest about those topics. That is how you can deal with the examiner. First and foremost, you remember that I have already told you in earlier sessions that interview is not at all a deciding factor, and interview is not going to pull you down from the list too much. Your rank may change a little bit, but you will not be out of the list just because of the mark in the interview. So, if you don't know any of the issues, honestly tell the examiner that you don't know that. Okay. Now, we will if you know those issues, you should be able to present those. If you don't know, you should be simply able to say you don't know it. That is how you should go forward in the interview, and it will not reduce your marks. Okay. So, let us discuss some general issues which may come up based on the recent news value and all. Okay. See how you pick topics. You have to pick the topics which was in news in the past 1 or 2 years. That is that shows that you are eager about what is happening outside outside your house in the society, and especially related to health related matters. Okay. And you also expect some opinion based question where you have to present an opinion. Okay. So, first issue you have to do is the identification of the topics. You have to identify the topics which comes up in news. Number 1, comes up in news repeatedly, and as you are preparing for KPSC medical officer interview, you should be specifying to the health issues faced by the state of Kerala, health issues which were in the news in the related to the state of Kerala. Such issues should be given some importance. For example, Kerala was having a devastating flood experience in the last 2 years. So, expect some questions related to that, and similarly you can also expect some questions related to disease which can be seen in people after the flood. Okay. So, waterborne diseases, what will happen, what are the diseases which are transmitted through contaminated water, how to prevent that, how to treat that, the significance of ORS, etc. Such things you should be knowing. Okay. So, let me start with one important topic which was there in news in the last 2 years. It is NIPAH. You know, even a movie was made related to this topic, the virus. Virus was the name of the movie. So, what is NIPAH? NIPAH is a viral infection. Okay. And in most of the people, NIPAH infection may be asymptomatic. That is, there will be no symptom at all and there will be no complication at all. Even the patient will not know he has got NIPAH. Okay. So, if it is a symptomatic infection, it may be having fever, cough, headache, shortness of breath and mental confusion. These are the clinical symptoms of NIPAH. And what you have to remember is that there is no vaccine for NIPAH as of now, and there is no specific treatment as of now. So, there is no treatment and no vaccine. Only thing that you can do is to prevent NIPAH. So, coming to Nipa virus. Nipa virus is a virus from the genus Nipa Virus. Nipa virus genus. There are many species in Nipa virus genus. All these are known to cause this fever called Nipah. It is a RNA virus. So, it is similar. What are the other RNA viruses? Suppose if this topic of Nipah is coming up and you are talking about RNA virus, the second question will be, can you tell me about other RNA viruses? So, you should be knowing that HIV is a RNA virus, You should be knowing Ebola is a RNA virus. That way you should be having some related points ready always. Then how does Nipah infect? Nipah is a disease which infects each other through direct contact or by droplet infection. So it can be, infection can be happening from man or animals, and you know the natural host of Nipah virus is fruit bat, a species of fruit bat which is common in Southeast Asia and South Asian region. Okay. So this natural host fruit bat is a reservoir of Nipah virus, and whenever someone is exposed to this virus from the bats, there is a chance for infection. So what are the methods of prevention which you can use? Avoid exposure. Okay. You have to avoid exposure with people infected by Nipah. If one of your friend is infected by Nipah or one of your relative is infected by Nipah, it is better not to have a contact with that person. Leave that person to the care of experts who are the medical experts and not have a contact with him, however close he or she may be. Then you have to avoid contact with bats, pigs, cattle, etc. when there is an outbreak of Nipah. Okay. Then you can also avoid palm sap or palm toddy, the drink which is made from palm, which is known as kallu in Kerala. Okay. This palm sap can get infected by Nipah virus because bats which are living on the palm and sometimes excreta of this bat may contaminate the palm sap and it may lead to a source of infection. So avoid drinking palm sap also during the time of Nipah infections. Okay. So you can understand the modes in which it is transmitted and you can avoid that. About 700 cases of Nipah virus are estimated to have occurred so far in the world. Globally, totally till now the total number of cases of Nipah which was reported was 700 only, and out of this the death mortality is around 50 to 75%. So most of the epidemics, when it happened, more than half of the people who were infected died of Nipah. This statistics is according to the statistics which was published in May 2018. So the infections which happened after that may not be included in this statistics. So what you have to understand from this statistics is that it is highly mortal to have Nipah. It is very difficult to save a patient who is infected by Nipah. Then coming to the history of Nipah, Nipah was first identified in 1998 in Malaysia, and after the infection happened, it was thought it would be pig fever, and pigs were culled in lot numbers in Malaysia, but ultimately virus was isolated in 1999, and because the first epidemic was reported from a village named Sungai Nipah in Malaysia, this virus was named as Nipah virus. And in this Malaysian case of infection, first epidemic which was reported in the history of humankind, the pigs were the source of infection. Pigs got infected from fruit bats and pigs transmitted the infection to man. Okay. And coming to Nipa fever, what you have to understand is that Nipa fever is having a incubation period of 5 to 14 days. So after the virus enters your body, the symptoms will be appearing only after about a week or after 2 weeks. So the first symptoms will be fever, headache and drowsiness. So you can easily mistake it for common viral fever because it is the common symptom, fever, headache and drowsiness. Then after some times disorientation develops and mental confusion develops. It is because there is a progress into infection in brain or encephalitis. And the issue with Nipah is that if Nipah is a fast progressing infection, that it can reach a critical stage and go to coma. The patient may go to coma within 24 to 48 hours of having symptoms. So this is the most critical and most dangerous issue. there is no much response time available if a patient is infected with Nipa. So, what are the complications of Nipa? The first and foremost complication is encephalitis, and second complication is pneumonia. So, Nipa virus may infect the brain and cause encephalitis, or Nipa virus may lead to there is a cough and mucus production swabs. Swabs can get aspirated into the lungs and cause pneumonia. These two are the most important complications of Nipa virus. Now, what are the investigations for Nipa? First of all, you have to understand this, that it is very difficult to identify Nipa case clinically, because the symptoms are common with viral fever and the investigation is reverse transcriptase polymerase chain reaction. Polymerase chain reaction is a complex reaction which is used in case of microbiology for identifying DNA. You might have studied about how DNA replicates. So, polymerase chain reaction is the mode by which DNA replicates, how copies of DNA is made. But reverse transcriptase polymerase chain reaction is using an RNA to replicate DNA. That is the mechanism how RNA viruses act. So, the same method is recreated in the lab to identify Nipa virus. So, RT-PCR is the only investigation which can clearly establish the identity of Nipa virus if a person is infected. This RT-PCR test is done from throat swabs, cerebrospinal fluid, urine and blood. Okay. Then Nipa had different outbreaks across the world, and most of the outbreaks, all of the outbreaks were reported from Malaysia, Singapore, Bangladesh and India. And the latest infection episode which happened in Kerala, there were 21 deaths, 21 people died out of Nipa in May 2018 in Kerala, and only 23 people were infected. So, out of 23 reported cases, 21 died. Only 2 people we could save their lives by treating the disease. And you may be knowing that, you must be knowing actually, one healthcare worker, a nurse named Lini, was infected and she died, and that was a critical point in the history of epidemic which happened in Kerala. And we had a second outbreak in May 2019. The first outbreak was in districts of Malappuram and Kozhikode, while the second outbreak in May 2019, exactly 1 year after the first outbreak, it was in Ernakulam district. 2 cases were reported, but fortunately we could identify the cases earlier and we could cure both of them completely. Then this is all what you should know about Nipa virus. So, you will be having some awareness about this. Some question can come up about Nipa virus because it was in news recently. Then another important topic which is in news recently, which is currently in news, is Kerala Clinical Establishments Act. Clinical Establishments Act is a very significant development in the health sector of Kerala, and you should be knowing something about that also. Okay. Coming to Kerala Clinical Establishments Act. Clinical Establishment Act, full name of the act is Kerala Clinical Establishments Registration and Regulation Act 2018. So, what is the aim of this act? The aim of this act is to provide for the registration and regulation of all private as well as public clinical establishment in the state from all recognized systems of medicine. So, the first and foremost aim is register and regulate all clinical establishment, private as well as public. So, government institutions are included as well as private institutions are included, and all the system recognized systems of medicine are included in this act. And additionally, what this Clinical Establishment Act do is to provide for prescription of minimum standards. So, what should be the minimum standard of treatment, minimum standard of care given in different clinical establishments, in different category of the clinical establishment. According to the category, the standard may differ. A standard which is applicable to a pathological lab may not be the same standard which is applicable to imaging lab. a standard which is applicable to homeopathic clinic may not be the same which is applicable to Ayurvedic clinic. So, that is provided for in this minimum standards for different categories. Now, coming to this history of Clinical Establishments Act, what you have to understand is that this act which is passed by Kerala right now is a continuation of act which was passed by Parliament in 2010, roughly 8 years back. What you have to understand is that in 2010 there was a discussion in India that there is no sufficient laws to regulate laboratories, clinics and hospitals in India. Many of the hospitals are not having minimum prescribed standards. Many of the hospitals are having lack of infrastructure. The staff are in the many of the hospitals, the staff is not qualified enough. So, all these are leading to issues. You may be even knowing that around 2009-10 there was even a New Delhi virus identified, New Delhi bacteria identified from AIIMS. Why it is known as New Delhi virus bacteria? Because it was a super bug or antibiotic resistant bug bacteria which was identified in India, in Delhi, which according to the research is expected to be developed from hospitals, because some bacteria which is a pathogen normally got exposure to different types of antibiotics in our hospitals, because hospitals are not disposing the waste properly, and this led to evolution of that bacterial genome to develop some antibiotic resistance. Now, this bacteria was accumulating different types of antibiotic resistance continuously, that it was resistant to almost all antibiotics described so far. So, this was also a critical point which you have to keep in mind. So, this Clinical Establishment Act 2010 by the Central Act was aiming to regulate clinical establishments in India, as the name indicates. So, all clinical establishments must register and provide for a set of minimum standard for treatment. So, there will be a minimum standard guidelines for common diseases and conditions. This was the aim of this act, and all clinical establishments were included except military establishments. Okay. So, what you have to understand is that there are different types of list in Indian Constitution. The 7th schedule of Indian Constitution has different lists. List 1 for central legislation, list 2 for state legislations, list 3 for concurrent legislations, and in the central legislation only central government can legislate. In the state list items only state can legislate, and in the concurrent items both the center and state can legislate, and if the law by the center is there, it will supersede the law by state. So, this is a basic concept which you have to understand. Now, health is a state subject, it is not a central subject. So, it is under the state government to decide what all should be there in health policy and what all laws should be there in health sector. So, even though central government passed such a law, it is not applicable to any of the state unless the state legislature or state legislative assembly decides to pass the same act again with modifications or without modifications. Okay. So, this law, Clinical Establishment Registration and Regulation Act 2010 of Parliament of India, was accepted by Arunachal Pradesh, Himachal Pradesh, Mizoram, Sikkim, Bihar, Rajasthan, UP, Uttarakhand, Jharkhand, Assam and Haryana before 2018 itself. But none of the states which passed this act implemented this act till now. They have just passed the act, they have not implemented it. Okay. Now, Kerala is also having one act in this tunes with the Clinical Establishments Regulation Act of Center. We have to see how it will be implemented. I think we have started implementing already. And coming to Kerala Clinical Establishments Registration and Regulation Act 2018, what is the definition of a clinical establishment? Clinical establishment is defined under section 2C of this Clinical Establishments Act as a hospital, a maternity home, nursing home, dispensary, clinic, sanatorium, or an institution by whatever name it is called that offers services, facilities with or without beds, requiring treatment, diagnosis or care for illness, injury, deformity, abnormality, dental care or pregnancy in any recognized system of medicine established and administered or maintained by any person or body of persons, whether incorporated or not. Okay. This is the definition of clinical establishment given in this act. So, what are the points which you can derive from this definition? Number 1, it can be a hospital, it can be a maternity home, and after the list it is saying that by whatever name it is called. So, the name of the institution is irrelevant, but the function of the institution is relevant according to the definition. Okay. Now, what is the function? Offers services, facilities with or without beds. Okay. So, whether it is a bedded institution or only OP institution, it is not a matter. Without beds, requiring treatment. Okay. Services requiring treatment, diagnosis, care for illness, injury, deformity, abnormality, dental care or pregnancy in any recognized system. So, these are the functions which are defined. Okay. And it can be a corporate or non-corporate. It can be private as well as government. Okay. It can be made by a person or by a body of persons. So, cooperative institutions are included, government institutions are included, private institutions are included, your clinic is included, while multi-specialty hospital is included. This is a holistic act. So, the definition continues in the second section that a place established as an independent entity. It can be independent entity or part of an establishment. So, it may be a single clinic or branch of another clinic. So, if you are having a branch of your same clinic or a hospital is having branch at another place, that also has to be registered separately. Okay. So, in connection with diagnosis or treatment of diseases where pathological, bacteriological, genetic, radiological, chemical, biological investigations or other diagnostic or investigative services with the aid of laboratory or other medical equipments are carried out. So, all laboratories or any place where medical equipments is used for disease diagnosis is by default included in this act. Okay. So, clinical establishments across all systems of medicine are included. It can be owned, controlled or managed by government or department of government, trust, private, public, individual proprietorship, partnership, corporation registered, whether or not owned by government or even by local self-governing bodies or local authorities, all these are covered by this act. Okay. This is what you have to understand. Now, according to section 3 of the act, there will be a state council for clinical establishments similar to our Travancore Cochin Medical Council, where all the clinical establishment in the state has to be registered. Okay. And instead of registering directly to the state establishment, clinical establishments council, what the method is followed is to have a district registration authority under section 17 of the act, and you can register with the district registration authority, and the district registration authority passes the information to the state council. This is how the act has defined the functioning. So, section 16 says that it is compulsory to register all the clinical establishments. Okay. Now, who all are the members of state council? Health secretary of the state, directors of all the systems of medicine which are working under health secretary. So, homeopathic secretary of homeopathic department will be there, secretary of health department will be there, director of homeopathy will be there, director of Ayurveda will be there. all these directors will be a part of state council. Now, council representatives for each system of medicine, central this TCMC medical council representatives for each system of medicine, one representative from medical council will be included in state council. Then nominated members will be there. One person can be nominated by the government from general public, a spirited person. Then there will be nominated members from each different systems. Okay. All these are provided for in the act. Then organization representatives are also there, IMA representative, Ayurvedic Doctors Association representative, Nursing Council representative, Medical Council representative, all these people will be there. But unfortunately or fortunately, the organizations are also there. Apart from official council representatives, of organization representatives are also there. That is what you have to remember, like IMA, IDA, all those things. IMA Kerala State Chapter representative. IMA Kerala State Chapter can send one representative who will be nominated by the government. So, similarly, Ayurvedic Doctors Association will also be there. But unfortunately or fortunately, homeopathic organization does not have a representative, maybe because the government has not been able to decide which organization will represent homeopaths in Kerala. Okay. According to the act, but government can pick one person from the organization based on its own discretion. Okay. What is the function of state council? State council, in the act, the minimum standard for each system is not mentioned. So, the state council will conduct studies, deliberate and decide what should be the minimum standard that is to be prescribed for each type of clinical establishment which is functioning in Kerala. So, the minimum standards will be decided by the state council. Then the state council also classify and categorize establishments, like establishments are classified into, for example, first classification is modern medicine, Indian systems of medicine, homeopathic, Ayurvedic, etc. And in modern medicine there is again sub classifications like specialty, super specialty, and under super specialty there is further classification like which is the specific super specialty. Such a classification is there. Okay. Then the state council also compile the register which is forwarded by different district register authorities, and they will publish this in a public domain, so that even if a patient wants to know whether a doctor is qualified or not, he can go to that website and understand the details of a specific institution to which that person is going. Then the state council also has this duty to assess each and every institution based on what are the criteria there, whether they are following minimum standards or not, and inspection can be conducted by the state council if needed. So, these are the provisions in Clinical Establishments Act for the state council. Now, coming to conditions for clinical establishments prescribed under section 18 of Clinical Establishments Act, the government can notify minimum standards. Okay. The government has the right to prescribe minimum standards. Of course, it will be done by the state council. Now, if any institution is not following this minimum standards of treatment, the council can deregister that institution or cancel the registration of that institution, and if the registration of an institution is cancelled, that institution cannot function. Okay. So, the state council prescribed minimum standards is mandatorily to be followed by everyone. Then this state council can also prescribe minimum qualification for staff, like what should be the minimum qualification for a doctor, what should be the minimum qualification for a radiologist, what should be the minimum qualification for imaging technician. All these things can be decided by the council. Then this state council can shall furnish information to the public about different institutions, different minimum standards, whether an institution is following the minimum standards or not. Okay. Apart from that, the State Council has a responsibility to ensure safety and standards in clinical establishments with a special aim of preventing further infection from the hospital. Okay. So, these are the conditions which are there under section 18, which every clinical establishment should follow based on the instructions from State Council. Now, coming to registration, there are two types of registration: provisional registration and permanent registration. Provisional registration is normally for 1 year, and according to the Act, all the establishments currently existing are to be given provisional registration whenever they apply. You have to apply within 1 year and you will get the provisional registration currently, and your provisional registration will be converted to permanent registration after 1 year after sufficient inspections in your institution. This is how the law decides the course of action. Okay. So, if within 1 year either if the council couldn't inspect you properly or you couldn't satisfy the conditions of the council, this provisional registration can be extended for 1 more year subject to some conditions. Okay. And then after 2 years you have to mandatorily get the permanent registration if your institution has to function. Okay. Now, the registration in this lab is this act is category wise. So, I have already told there is category wise classification of clinical establishments, and category wise registration will be there for homeopathic separate, for Ayurveda separate, for pathological lab separate, for diagnostic lab separate, but one exception is given that if a lab is attached to a hospital, attached labs may not register separately. So, if a hospital is having a homeopathic department and a Ayurvedic department and a modern medicine department, all these three should be registered separately, but attached lab may not register separately subject to some conditions. Okay. Then another exception given in this act is if there is an institution which is providing only consultation services. For example, you are having a clinic where medicine is not distributed, where you are not giving medicine to the patients, you are not having an attached lab, but you are just consulting the patients and giving a prescription for outside. Even in that case, you have to register the institution, but there is no prescribed minimum standards under section 18. Section 18 will not apply to such institutions which are only for consultation services, where medicine is not given, where diagnostic devices is not used, and the medicine is prescribed for outside use. Even then you have to register the institution. There is no exception in registration, but there is an exception in minimum standards. Okay. Then there should be information should be given in public domain by the institution, like what all cases are treated, what are the minimum standards which you follow. This should be displayed in the clinic. You have to make a board which displays what all type of diseases you treat, what are the minimum standards in which you treat the diseases. All these things should be shown in the board, exhibited on a board in your clinic. Similarly, different charges which you charge for each and every service also has to be displayed in the clinic. So, information should be given about the services which you offer as well as charge which you take for each and every service. Now, this act is a civil act which will have civil liability for omissions, and there is hefty penalty for violation of this act. The penalty ranges from 10,000 to 5 lakhs. If you are doing a offence which is not which is defined by this act as an offence, but not a penalty is not clearly defined. Okay. Clinical establishment wants you to do in a particular manner, but what is the punishment is not said in the act. In that case, first offence will attract a fine of 10,000 rupees. So, first time you are violating the law, you will be paying 10,000 rupees. Second offence, again if you are committing the same offence, subsequent offence will attract a fine of 50,000 rupees, and if you are doing the offence again, the third subsequent offence will attract a fine of 5 lakh rupees, and all the subsequent offence will attract fine of 5 lakh rupees. This is the prescribed penalty in this act. So, this is the general punishment described in the act. Then apart from that, non-registration of your clinical establishment can also have same punishment, but the quantum of fine is higher. First offence 50,000, subsequent offence 2 lakh, and further repetition of offence 5 lakhs. And after your clinical establishment is not registered and you are fined and you are continuing to operate even after fining in an illegal manner, then you can be charged 10,000 per day of operation up to 5 lakhs. So, per day you will be charged 10,000, but maximum cap is 5 lakhs. There will be no fine more than 5 lakhs. So, disobeying the orders of the council or the bodies created under the council, obstructing the function of the council, like if council is coming to inspect your dispensary and you are not willing to allow them to inspect, refusal of information, like if council asks you for some information related to your clinic and you are not providing the information, there can be a fine up to 1 lakh. Okay. So, that is the penalty for obstructing the function of the council, non-obeyal of the orders, or for such offences. If there is a minor offence, if there is a genuine lapse at your part, it is not a offence which you did with intention, unintentional omissions, and if it is a minor offence, then the fine will be 10,000 rupees. Okay. And in this provision of the acts, it is even mentioned that offences by companies can be fined, offences by government institution can be charged. Okay. If it is an offence by company, the directors of the company who is having administrative charge are equally liable. At the same time, if it is an offence by government institution, the person who is in charge of that government institution is liable. So, you can understand that if, for example, if you are selected as a medical officer and your institution, the dispensary in which you are posted, violates the law, you are responsible for the violation and you have to pay the fine. So, it is very important for all the medical officers and aspiring medical officers as well as private doctors. Okay. So, this is one of the most controversial topic, and I am expecting some opinion based question also from Clinical Establishments Act, because there is a lot of controversy, because some doctors are opposing it, some are supporting it. Okay. But in my honest opinion, I think that it is a good step to ensure standards of health care in our state, to improve the standards of health care further. Okay. And of course, in the beginning there will be some difficulties, but we have to comply with the act to ensure that we are doing the best for the patients. Okay. So, you should have a positive answer and a positive approach to all these issues. Even COX can be controlled by this act, because only the systems which are recognized are allowed to be registered. So, automatically COX cannot register themselves and they will automatically be thrown out of the cycle of healthcare.